Welcome to Renus Care Radio, where we dive deep into the latest insights and advancements in kidney care. One of the critical aspects of managing chronic kidney disease involves controlling serum phosphate levels, as phosphate balance is often disrupted in this condition. Excessive phosphate levels can lead to serious complications, including cardiovascular disease and bone disorders. This episode explores the importance of phosphate management in CKD patients, the challenges it poses, and the strategies utilized to maintain optimal phosphate levels. Phosphorus, a mineral found naturally in many foods, is essential for building and repairing bones and teeth, maintaining nerve and muscle function, and supporting the synthesis of ATP, the body's energy currency. In healthy individuals, the kidneys efficiently regulate phosphate levels by adjusting the amount excreted in urine. However, as kidney function declines in CKD, phosphorus begins to accumulate in the blood, a condition known as hyperphosphatemia. Hyperphosphatemia is a frequent complication in advanced CKD and is linked to increased mortality and morbidity. It contributes to the risk of vascular calcification, which is a significant factor in cardiovascular disease, the leading cause of death in CKD patients. Furthermore, high phosphate levels can lead to secondary hyperparathyroidism and renal osteodystrophy, conditions that weaken bones and can cause skeletal deformities and pain. Phosphate management in CKD presents several challenges. First, phosphate is ubiquitous in food, especially in protein-rich and processed foods. Patients with CKD are often advised to follow a restricted diet, which can be difficult to adhere to, particularly over long periods. Second, the body's ability to excrete phosphate decreases as kidney function worsens, necessitating medical interventions. Phosphate binders are commonly prescribed to control hyperphosphatemia. These medications bind phosphate in the gastrointestinal tract, preventing its absorption into the blood. However, these binders must be taken with meals, and their effectiveness depends on strict adherence to both dosage and timing, which many patients find challenging. Dietary management is fundamental in controlling phosphate levels. CKD patients are counseled to avoid high-phosphate foods such as dairy products, nuts, seeds, beans, and certain whole grains. Nutritionists often recommend focusing on natural foods with lower phosphate content and avoiding foods with phosphate additives commonly found in processed foods. Several types of phosphate binders are available, including calcium-based binders, such as calcium acetate and calcium carbonate, and non-calcium-based binders, such as sevelamer and lanthanum carbonate. The choice of binder depends on various factors, including the patient's stage of CKD, calcium levels, and individual response to treatment. Regular monitoring of phosphate levels allows healthcare providers to make timely adjustments to dietary recommendations and phosphate binder dosages. Additionally, the management of associated conditions like secondary hyperparathyroidism is vital, which may require vitamin D analogs or calcimimetic agents. Managing phosphate levels in CKD patients is crucial for preventing the complications associated with hyperphosphatemia and improving the overall quality of life. It involves a comprehensive approach that includes dietary management, medication, and regular monitoring. Effective phosphate management can significantly reduce the risk of cardiovascular disease and bone disorders in CKD patients. Thank you again for joining us here on Renus Care Radio.